Hello everyone, we are the Group 6. Hope you're doing well today and enjoying your long weekend with your family and friends. Now, we will gonna explain to you our given topic, which is the medical terminology, specifically the root or base words for bones, joints, and skeleton. For the objectives, after this presentation, students will gain the following. 1. We will be knowledgeable to the different roots or base words for bones, joints, and skeleton. A. On how they have been get and used in a medical terminology. B. Some examples dealing with the different root or base words from bones, joints, and skeleton. C. Its significance or the significance in knowing the different root or base words for bones, joints, and skeleton. And lastly, number 2, the importance of our skeletal system. Before we were gonna jump on to the main topic of this presentation, let's recall first some of the terminologies we used to encounter when we're still in high school up until now this college. These are 1. Skeletal system, number 2. Skeleton, number 3. Bones, number 4. Joints, lastly, root or the base word. Number 1. Skeletal system. Skeletal system is a system that acts as the internal framework of the human body. If we're talking about internal framework, we're talking about the structure, categorization, or it serves as a guide. Or we are expecting that there is a function or concept. In addition, skeletal system is very important as it gives supports and protection to our body, like our skull shields our brain, our ribs protects our heart and lungs, and many more. Furthermore, skeletal system provides locomotion. If we're talking about locomotion, we're talking about the movement of our body. And it is also responsible for blood reproduction by the process called hematopoiesis, which undergo or undergone in our bone marrow, specifically in the red bone marrow. Number 2 is the skeleton. Skeleton is a framework that gives shape and support our body. Number 3 is the bone. The root word for bone is oste or osteo, and bones is refers to any pieces of hard living tissue making up the skeleton in the human and other vertebrate. And osteogenesis is the formulation of our bones or the process for bone reproduction. And fun fact is that there are 206 bones in adult human body, not including the teeth and the sesamoid bones. However, according to the National Library of Medicine in 2022, there are typically around 300 to 270 bones in human infants or in babies, which fuse to become 206 to 213 bones in the human adult. Next on the list is the joints. Joint is the point of contact between two bones. Without them, movement would not be impossible. And the root or base word for joints is arthro. A-R-T-H-R-O. Arthro. Lastly, for number 5, the root or base word. Root or base word refers to the main body of the word, and it can be paired with prefixes and suffixes. It is crucial for us to know the root or base word in order for us to understand the language of medicine, and we can use this in our future affiliation in the hospital kapag 3rd year or 4th year na tayo. Now that we've finished recalling some of the terminologies, Let's now jump on to the main topic of this presentation, which is the roots for bones and joints. Number one on the list is the oste or osteo, which means bone. And here are some of the example of the root word osteo. Number one is osteopenia. From the word osteo means bone, and penia means deficiency or decrease. And the definition of osteopenia is the deficiency of bone tissue. Number two is the osteoporosis. From the word itself, osteo means bones, and porosis means or osis means condition. The definition of osteoporosis is a medical condition in which bones become brittle and fragile from loss of tissue. Now, the causes for osteopenia and osteoporosis are poor protein intake, diet low in calcium and vitamin D. Kasi 'di ba guys, ang calcium is very important kasi yun yung bumubuo sa ating bones or siya yung dahilan kung bakit matigas yung bones natin. Kaya need natin ng calcium and vitamin D. Also, too much take of PPI or the proton pump inhibitor, which can increase the risk of osteoporotic fracture or yung pag decrease or pag what do you call this, pag-brittle ng ating bones. And if osteopenia left untreated, magiging osteoporosis siya. And if osteoporosis left untreated na naman, magiging severe osteoporosis. You know what guys? Osteopenia and osteoporosis is wala siyang gamot. However, there are certain medication na pwedeng i-take ng mga patient na may ganitong sakit para ma-decrease or para mapabagal yung pag-brittle or pag-fragile ng kanilang mga buto. So next example for the root or base word osteo is the osteoma. From the word itself, oste means bones and oma means tumor. Therefore, the definition for osteoma is a benign bone tumor that usually remains small and localized. Kapag sinasabi natin na localized, nasa certain area lang siya. And since it is benign tumor, hindi siya nakakamatay. However, if nababawasan na yung self-esteem mo or yung confidence mo dahil sa osteoma na nasa forehead mo, pwede mo siyang ipatanggal guys. Kasi meron namang procedure which is the open incision surgery procedure para matanggal ang osteoma sa ating katawan. Some causes for osteoma is the abnormal growth of cell or the neoplasia. Moreover, if the patient has injuries or traumas or excessive inflammation, it can also cause these what you call osteoma. You can see in the picture the osteoporosis stages where you can see here the healthy bones, then the bones that has osteopenia. Then if osteopenia left untreated, magiging osteoporosis na siya. And kapag na-left untreated again ang osteoporosis, kapag napabayaan, magiging severe osteoporosis na siya. Here on the next picture, you can see an X-ray or the MRI view of an osteoma. May bukol na nakita sa ulo ng isang tao, which is yung bukol na yun na yung tinatawag natin na osteoma, which is a benign tumor. Now, let's move on to another root or base word for joints and bones, which is the miel or mielo, which means bone marrow or spinal cord. And here are some of the medical terminologies using the root or base word miel or mielo. Number one example is the myeloid cell. Myeloid cell refers to the family of immune cells, which are the monocytes, macrophages, granulocytes, mast cells, myeloid dendritic cells, or the MDCs. And you know what, guys? The function of immune cells in our body serve as a defender, which defend the body from invading pathogens, bacteria, viruses, and a lot more. Next on the list is the myelitis. Myelitis, from the word itself, myel, which is bone marrow or spinal cord, and itis, which means inflammation. From the meaning of the word itself, the meaning of myelitis or definition of myelitis is the inflammation of the spinal cord or bone marrow, usually caused by infection or autoimmune disease. Now, in addition, for the causes of the myelitis, these are the viral, bacterial, and fungal infections, herpes virus, zoster, and a lot more. And for the treatment for myelitis, these are the IV steroids or the intravenous steroids, antiviral medication, plasma exchange therapy, and a lot more. For the third example using the root or base word myelo is the myelogram. Myelogram is an X-ray examination machine for the spinal cord taken after the contrast dye has been injected into the cerebrospinal fluid. If you still remember, guys, cerebrospinal fluid is the fluid that you can see around our brain and in our spinal cord. And you know what, guys? Myelogram serve as a diagnostic imaging apparatus or device where the test procedure of this myelogram is called myelography. Now guys, here in the first picture, it shows the myeloid cell under the microscope. So ganyan yung illustration or ganyan yung image ng myeloid cell natin, guys, under the microscope. Next, in the second picture, there is a two image. In the image in the left side is a normal spine, while in the right side is the transverse myelitis, the spine that has a inflammation. As you can see, the difference, mas lumobo yung image na nasa right side due to the inflammation. And for the third picture, sa baba is the myelogram. So, ganyan po yung image ng myelogram natin. Now, I will now give the floor to Miss Alawi for her to explain the other roots or base words for bones and joints.
Another root for bones and joint is chondro. Chondro means cartilage. Is a tough, flexible connective tissue found in various parts of the body, such as joints, the nose, ears, and in between vertebrae. Its function includes providing structural support, reducing friction in joints, and aiding smooth movement by absorbing shock and distributing pressure. Its job is to help our body stay strong, make our movements smooth, and act like a cushion to protect us. One example pertaining to the root chondro is chondroblast. Blast refers to an immature or actively dividing cell. A chondroblast is like a builder cell for our body's strong and bendy material called cartilage. It makes the stuff that holds cartilage together and helps it grow, stay healthy, and fix itself. As time goes on, these builder cells grow up into more settled cells called chondrocytes, which are more mature and less active cells within the cartilage. Another example is chondrocyte. A chondrocyte is a mature and calm cell in our body's bendy material called cartilage. It helps keep cartilage strong, flexible, and in good shape. Think of it like a caretaker making sure our cartilage stays healthy and works well. Let's move on to another example. Chondromalacia. Chondromalacia, or also known as runner's knee or patellofemoral pain syndrome, is when the smooth surface of the cartilage in our knees or other joints gets a bit rough or soft. It can make moving our knees feel uncomfortable or grating. It's like a little hiccup in how our knees cushioning works.
So now, let's move on to another root or base word for bones and joints, which is art or archo. Archo, meaning joint or any junction between two different parts. It comes from the Greek archon, which means joint. We have here an example of archo, which is arthrosis, arthritis, and arthroplasty. The word arthrosis is composed of the prefix arthro from the word itself, which means joint, and the suffix is osis, which means a condition, state, or process, usually abnormal or disease. Therefore, arthrosis means a joint condition affecting a joint or a degenerative joint disease. Arthrosis occurs when the cartilage that covers the ends of the bones in the joints wears away, leading to bone-on-bone friction and inflammation. Arthrosis can affect any joint in the body, but it is more common in the knees, hips, spine, and hands. Some of the causes of arthrosis are age. As people get older, their cartilage becomes thinner and less elastic, making it more prone to damage. We have injury, trauma to the joints such as fractures and dislocation. We have also an obesity. Excess weight puts more pressure on the joints, especially the knees and hips. And lastly, other diseases. Conditions that affect the metabolism such as diabetes and immune system. Some of the treatments for arthrosis are medications, physical therapy, alternative therapies, and surgery. Arthrosis is a chronic and progressive condition that cannot be cured. However, with proper treatment and lifestyle, it change such as losing weight, quitting smoking, and avoiding overuse of the joints. People with arthrosis can manage their symptoms and improve their quality of life. So now let's move on to arthritis. The word arthritis is composed of the prefix arthro, which means joint, and the suffix itis, which means inflammation. Therefore, arthritis means inflammation of the joints. So, arthritis can cause pain, stiffness, swelling, and reduced mobility in the affected joints. The causes and treatments of arthritis vary depending on the type and severity of the condition. Some of the most common types of arthritis are osteoarthritis. This is the most common form of arthritis, which occurs when the cartilage that covers the ends of the bones in the joints wears away over time. We have rheumatoid arthritis. This is an autoimmune disease, which means that the body immune system mistakenly attacks its own tissues. The treatment of arthritis depends on the type and severity of the condition. Some of the common treatments include medications, physical therapy, alternative therapies, and surgery. So, we have the last example of arthro, which is arthroplasty. The word arthroplasty is composed of the prefix arthro means joint and the suffix plasty means surgical repair of a joint, which can involve replacing, reshaping, or reconstructing the joint. Therefore, Arthroplasty means it is the partial or total replacement of a joint with a prosthesis. So what is prosthesis? Prosthesis is an artificial device that replaces a missing body part such as limb, an organ, or a facial feature. The causes of arthroplasty are usually related to the wear and tear or damage of the cartilage that covers the ends of the bones in the joints. This can also lead to bone spurs, deformity, and loss of function in the joint. The treatment of arthroplasty involves removing the damaged cartilage and bone tissue from the joint and replacing them with prosthetic parts made of metal, plastic, or ceramic. The most common joints that undergo arthroplasty are the hip and knee, but other joints such as shoulder, elbow, ankle, and finger can also be treated with arthroplasty. Arthroplasty can help to relieve pain, improve function. However, it also some risks and complications such as infection, bleeding, injury, and etc. Therefore, arthroplasty is usually recommended only when other treatments such as medications, physical therapy, assistive devices, or lifestyle changes have failed to provide adequate relief. That's all for arthro. Now let's move on to synovo.
Hello everyone, my name is Mariel Abad and I am tasked to discuss two medical terminology. Number one, we have synovo or synovia, a synovial membrane sheet around the tendon. Number one example of this is the synovitis, and the suffix used here is itis, which means inflammation. So synovitis is simply the inflammation of the synovial membrane. Number two example is asynovia. We have a prefix used here, a or a, which means lack or absence. So asynovia means absence or insufficient secretion of synovial fluid of a joint. Number three example is the synovectomy. Ectomy is the suffix used, which means removal. So synovectomy is the removal of the synovial lining of the joint via either an open or an arthroscopic approach. Next one, we have another medical terminology, which is the bursa or burso. From ancient Latin word bursa, which means a bag. A lubricated fluid-filled sac or pouch between tendons, muscles, and bony prominence, such as elbow, knee, or shoulder. The bursa acts as a cushion when muscles, tendons, or skin rub against the bones, thereby reducing friction and prevent wear and tear. There are over 150 known bursae in the human body. Injury to bursa may cause pain to loss of movement. So there are three examples of disease of bursa or disease causing bursa. Number one, we have bursitis. There is a suffix word here, itis, which means inflammation. So the inflammation of the bursa. An inflamed bursa is usually the result of injury, overuse, infection, age, gut, or rheumatoid arthritis. Most commonly, the hips, elbows, or shoulder are affected. However, inflammation may also develop in the knee and the feet. Number 2, we have bursectomy, ectomy, which means removal. Bursectomy is surgical removal or of the inflamed bursa, typically done arthroscopically. The procedure is less invasive and the recovery is quicker. Number 3, bursopathy. Fatty means disease. So bursopathy is any disease involving bursa, like bursitis for example. Last, we have peribursa. The prefix peri means around. So peribursa is surrounding a bursa or around the bursa. That's all. Thank you.
Let's move on to the roots for the skeleton. Number 1. Crânio. Crânio is derived from the Greek word crania, meaning skull. The cranium or skull is composed of 22 bones, and it is divided into two regions: the neocranium, which protects the brain, and the viscerocranium, which forms the face. And now, let's move on to the example. First is the craniometry. Craniometry refers to the measurement of cranium. So, craniometry is a branch of physical anthropology dealing with the study and measurement of dry skulls after removal of its soft parts. And for the second example, craniometaphyseal dysplasia. So, craniometaphyseal dysplasia is a combination of cranio, meaning skull, meta means beyond, physeal means growth plate, and for the dysplasia, this means abnormal, and plasia means growth or cellular multiplication. So, craniometaphyseal dysplasia is a rare condition characterized by thickening or overgrowth of bones in the skull and abnormalities in a region at the end of long bones, known as the metaphysis. So, the X-rays of individuals with craniometaphyseal dysplasia shows unusually shaped long bones, particularly long bones in the legs. The ends of these bones are wider and appear less dense than usual in people with these conditions. And there are also two types of craniometaphyseal dysplasia, which are distinguished by their pattern of inheritance and genetic cause. They are known as the automosal dominant and automosal recessive types. So let's talk about the two types of craniometaphyseal dysplasia. So the first one is automosal dominant pattern. So the individuals who has this type of craniometaphyseal dysplasia typically has a one parent who also has the condition. And for the second one, automosal recessive pattern. So here, the parents of an individual with an automosal recessive pattern, each one carries one copy of the mutated gene, but they typically do not show signs and symptoms of the disorder. The typical signs of CMD or craniometaphyseal dysplasia are the lifelong bone deposition in the bones of the face and head, and the widening of the ends of long bones. And the typical facial characteristics who has this condition are wide set eyes and a prominent jaw. And the treatment for this disorder is surgery to reduce the compression of cranial nerves and spinal cord. Last example, craniosynostosis. So craniosynostosis is a birth defect in which the bones in a baby's skull join together too early. So craniosynostosis, as the baby's brain grows, the skull becomes more misshapen, and the spaces between a typical baby's skull bones are filled with flexible material called sutures. These sutures allows the skull to grow as the baby's brain grows. Around 2 years of age, a child's skull bones begin to join together because the sutures becomes bone. So when this occurs, the suture is said to close and that can limit or slow the growth of the baby's brain. So some of the symptoms or signs when your baby or a baby has this disorder is that when a baby is poor in feeding, increasing of its head circumference, projectile vomiting, and very noticeable scalp veins. So treating craniosynostosis usually involves surgery to unlock bones and reshape the skull. Craniosynostosis has been treated using surgical methods that involve an incision from ear to ear and the removal, reshaping, and reattachment of affected bones. And now, let's move on to number 2. Spondylo. Spondylo is derived from the Greek word spondylos, meaning spine. It is our body's central support structure, and it connects different parts of our musculoskeletal system. It also helps us to sit, stand, walk, twist, and bend. And now, may I call on Miss Charlene Ancheta to explain more about the spondylo.
Here are the examples. The first example is spondylolysis. Spondylolysis is a combination of spondylo, which means vertebra, and lysis, which means dissolve and so means dissolution of a vertebra. Spondylolysis is a specific injury having a pars fracture in the pars interarticularis in your spine. It can happen from repetitive stress or injuries to the spine. Spondylolysis is a stress fracture through the pars interarticularis of the lumbar vertebrae. The pars interarticularis is a thin bone segment joining two vertebrae. It is the most likely area to be affected by repetitive stress. Some kids are born with spondylolysis. Spondylolysis is a very common cause of lower back pain in kids, teens, and young adults. This is a chronic condition, which means there's no cure. But there are ways to treat cervical spondylolysis so its symptoms don't affect your quality of life. Spondylosis. It is a condition in which there is abnormal wear on the cartilage and bones of the neck. It is a common cause of chronic neck pain. Spondylosis is caused by chronic wear on the spine. The most common cause of spondylosis is the cumulative joint stress that occurs as people age. It predisposes them to osteoarthritis, a common form of arthritis typically associated with progressive wear and tear on joint cartilage. Spondylosis may also arise as a result of previous trauma to the spine. Typically, non-operative measures are effective in treating the symptoms associated with spondylosis. Non-operative measures include pain medications and physical therapy. Spondyloarthritis. Spondyloarthritis is a group of diseases characterized by inflammation in the spine and joints. Spondyloarthritis is an inflammatory arthritis affecting the spine. There are types of spondyloarthritis. The first one is ankylosing spondylitis, a variant of spondyloarthritis that affects young adults. In ankylosing spondylitis, inflammation in the spine and sacroiliac joints causes chronic pain and stiffness in the back. The second one is axial spondyloarthritis, a form of arthritis that mostly causes pain and swelling in the spine and the joints that connect the bottom of the spine to the pelvis. The third one is enteropathic spondyloarthritis. Is a spondyloarthritis which occurs in patients with inflammatory bowel diseases and other gastrointestinal diseases. The fourth one is peripheral spondyloarthritis. Is the term for patients with features of spondyloarthritis whose symptoms and findings are predominantly or entirely peripheral rather than axial. These features include arthritis which is predominantly of the lower limbs or asymmetric, enthesitis, and dactylitis. The fifth one is psoriatic arthritis. Is another variant of spondyloarthritis. In psoriatic arthritis, psoriasis of the skin is paired with musculoskeletal features of spondyloarthritis typically affecting peripheral joints. The last one is reactive arthritis is inflammatory arthritis that manifests after several days to weeks after a gastrointestinal or genitourinary infection. It is also described as a classic triad of arthritis, urethritis, and conjunctivitis. Vertebro, a combining form used in anatomy to indicate a connection with or relation to a vertebra, vertebrae, or the spinal column. The individual bones of the spine are the vertebrae. These are the building blocks of the spinal column. The vertebrae protect and support the spinal cord. It provides stiffening for the body and attachment for the pectoral and pelvic girdles and many muscles. They also bear the majority of the weight put upon your spine. The spinal column gives your body structure and support. It allows you to move about freely and to bend with flexibility. The spinal cord is a column of nerves that connects your brain with the rest of your body, allowing you to control your movements. Paravertebral. Paravertebral is situated, occurring, or performed beside or adjacent to the vertebral or spinal column. Paravertebral derives from the adjective vertebral, which means having or composed of vertebrae, and the prefix para means beside, about, or near. Vertebrobasilar insufficiency. It is a condition characterized by poor blood flow to back portion of the brain, which is fed by two vertebral arteries that join to become the basilar artery. Basilar means located at or near the base of a structure, especially the base of the skull. Blockage of these arteries occurs over time through a process called atherosclerosis, or the buildup of plaque. Plaques are made up of deposits of cholesterol, calcium, and the other cellular components. They not only make the arteries hard, they grow over time and can obstruct or even block the flow of blood to the brain. A technique called endovascular repair is used to treat vertebrobasilar insufficiency. It involves the placement of a catheter in an artery of the groin through a small nick in the skin. Intervertebral disc disease, a common condition characterized by the breakdown of one or more of the discs that separate the bones of the spine, causing pain in the back or neck and frequently in the legs and arms. The term disc is short for intervertebral disc. These are the spongy cushions that separate the bones of the spine. These provide shock absorption, keep the spine stable, and give the vertebrae pivot points to allow movement. Underlying causes of this degeneration include genetic inheritance, age, inadequate metabolic transport, and loading history, all of which can weaken this to such an extent that structural failure occurs during the activities of daily living. Intervertebral disc disease cannot be reversed or cured. However, certain lifestyle changes can aid in avoiding further deterioration and help to manage the symptoms. Many treatments for degenerative disc disease aim to relieve stress and pressure from the spine to aid with the symptoms of the disease.
The next root word is raki or rakio. Raki or rakio means spine. The spine is the vertebral column or the backbone in the human body. The spine is the crucial part of the skeletal system and the central support structure for the body. It serves to protect the spinal cord, a bundle of nerves that carries messages between the brain and the rest of the body. So we have here an example which is rachis. The suffix word "chisis" is a fissure, means fissure. So when we combine the root word and the suffix word, the meaning of rachis is fissure of the spine. So ano nga ba ang rachis? Rachis is the embryological failure of the neural tube to fuse or close completely, thereby resulting in the vertebrae overlying the open portion of the spinal cord not to fuse and remain open, leaving the spinal cord exposed. Rachis is a developmental birth defect. The posterior neuropore of the neural tube of developing embryo in uterus failed to close completely. Rachis may affect anywhere along the vertebral axis. It may also affect the entire spine. Rachis is found to occur commonly with cranial neural tube defects such as anencephaly, acrania, anencephaly, and myelomeningocele. Rachis is a form of spina bifida, which is defect during embryological development characterized by an incomplete closing of the backbone and membranes surrounding the spinal cord. Two major types of spina bifida includes the spina bifida occulta and the spina bifida cystica. Rachis is a subtype of spina bifida cystica, together with the other subtypes such as meningocele and myelomeningocele. Rachis is described to be most severe for among the three subtypes. The next example is rachiocentesis. The suffix word centesis means the withdrawal of fluid. So, the definition of the example is a medical procedures involving the withdrawal of fluid from the spinal cord or the space around the spinal cord, which is the subarachnoid space, for diagnostic or therapeutic purposes. A lumbar puncture or spinal tap, or which is the rachiocentesis, may be done to diagnose or treat a condition. For this procedure, your healthcare provider insert a hollow needle into the space surrounding the spinal column, which is the subarachnoid space, the lower back to withdraw some cerebrospinal fluid or inject medicine. So cerebrospinal fluid is a clear fluid that batches and cushions the brain and spinal cord. It is continuously made and reabsorbed in the brain. Cerebrospinal fluid is made up of cell, water, protein, sugar, and other substances that are essential to maintain balance in the nervous system. So, why might need rachiocentesis or spinal tap? A lumbar puncture may be done for various reasons. The most common reason is to remove a small amount of cerebrospinal fluid for testing. This can help in the diagnosis of various disorders. The fluid is tested for red and white blood cells, protein, and glucose. The clarity and color of the fluid are also checked, and it is tested to see whether bacteria, viruses, or abnormal cells are present. The excess cerebrospinal fluid may also be removed in the people who have an overproduction or decreased absorption of deep fluid. A lumbar puncture procedure may be helpful in diagnosing many diseases and disorders, including meningitis, encephalitis, myelitis, neurosyphilis, Reye syndrome, Guillain-Barré syndrome, and many more. The last example is rachialgia. The suffix word algia means pain. So the definition of rachialgia is pain in the back or spine. So, mostly mga office worker po ang nakakaramdam ng back pain or di kaya po yung mga nagbubuhat ng mga mabibigat. So, paano po natin maiiwasan ang back pain? We need to exercise po or do stretching para maiwasan po yung sakit ng likod.
Good day everyone, I am Eliza Mika Firme Adviento and I'm going to discuss the cos or the costa, which means the ribs. So what is ribs? In anatomy, ribs refers to the long curve of bones within the body which serve as a protector or guard of the lungs, heart, and other internal organs in the skeleton of the thorax or the thoracic cavity. Ribs have 12 pairs which counts into 24 pieces. The first example is the costochondral, which defined as pertaining to a rib and its cartilage. So under the costochondral, we have three classifications of the rib cartilage. They are called true ribs, false ribs, and floating ribs. There are 7 pairs of the ribs. We call this as true ribs because it has a direct anterior attachment to the sternum ribs or the breastbone with the help of the strip of hyaline cartilage called costal cartilage, which serve as the soft bones of the rib cage. The remaining 5 pairs of ribs are termed false ribs because their costal cartilage is either attached indirectly to the sternum or does not attach to the sternum at all. The false ribs are also called vertebrochondral ribs. To sum up, the 1 to 7 pairs of the ribs is called as true ribs, while the false rib is the 8th, 9th, and 10 pairs of the ribs because their cartilage is interconnected to the cartilage of the pair 7. The floating ribs are the 11th and 12th pairs as their cartilage is not attached to any of the cartilage of the other pair that is connected to the sternum. The second example is the costochondritis, which defined as the inflammation of the rib cage connects a ribs to the breastbone. So costochondritis, or the inflammation of the ribs cartilage, is characterized by a local tenderness and pain in the anterior chest wall that may radiate. The symptoms may feel like amoebic chest pain associated with a heart attack. For example, the chest wall pain in most cases is described as dull, aching, sharp, or stabbing pain that varies in intensity. So how to ease the pain of costochondritis? Costochondritis most often goes away on its own in a few days or weeks. It can also take up to a few months. Treatment focuses on relieving pain. Apply hot or cold compress and rest. And last but not the least, example 3 is the costotomy, which refers to the resection or removal of the ribs. For example, surgeon doctors do costotomy in performing transplantation of internal organs within the thoracic cavity. As the rib cage serves as a guard of the organs, surgeon cannot perform transplantation of organs or surgery without removing it. That's why costotomy is one of the hardest surgery as it is a very risky process. Costotomy is performed also due to various medical reasons. A lot of people, especially in the Western country, let their other rib cut off as a form of body modification. So that's all about the ribs or the costo. Let's move on and talk about the sarc or the sarco that we'll be going to discuss by Miss Johanna and me.
The next root word is sarc or sarco. This root word means sacrum, and we have here an example which is prosacral, that refers to a location or anatomical structure that is situated in front or anterior to the sacrum. The sacrum is a triangular bone located at the base of the vertebral column, and it plays a vital role in connecting the spine to the pelvis. The next example is the sacroiliac joint. The sacroiliac joint is located between the sacrum, the triangular bone at the base of the spine, and the ilium, one of the large bones of the pelvis. This joint is essential for connecting the spine to the pelvis and plays a crucial role in supporting the upper body's weight and transferring it to the lower limbs. It is synovial joint, which means it contains a fluid-filled cavity that allows for limited movement. The sacroiliac joint's primarily function is to provide stability and transmit forces between the spine and the pelvis, allowing for activities such as walking and standing. The last example is the sacrospinous ligament. The sacrospinous ligament is a thin triangular-shaped ligament in the pelvis that attaches from the ischial spine to the lateral regions of the sacrums, and sometimes in the coccyx. This ligament, along with the sacrotuberous ligament, help to form the greater and lesser sciatic foramina, which are openings in the pelvis through which is important blood vessels and nerves pass. The sacrospinous ligament provides stability to the pelvis and support various pelvic organs.
The root cocci means coccyx. Coccyx is our tailbone, a small triangular bone located at the bottom of the spine below the sacrum. It's composed of several fused vertebrae and serves as an attachment point for ligaments and muscles. The coccyx has no major function in modern humans, but may provide some support for sitting and stability for nearby structures. One example for the root cocci is coccygeal. The word "gil" is not a standalone suffix or component with a specific meaning. Gil itself doesn't have an independent medical or an atomical meaning. Refers to anything related to the coccyx. Coccygeal pertains to the coccyx. It's an adjective used to describe things related to or located near this particular bone or area of the body. For example, coccygeal pain refers to discomfort or pain in the tailbone region. Another example is coccydynia. Dynia is a medical suffix used to denote pain or discomfort. Is a medical term used to describe pain or discomfort in the coccyx, the small triangular bone at the bottom of the spine. This condition can result from injury, trauma, or inflammation in the coccyx area, causing localized radiating pain, especially during sitting or movements that stress the tailbone. Treatment may include pain management, physical therapy, or in severe cases, surgical interventions. It's essential to consult a healthcare professional for proper diagnosis and management. Causes of coccydynia involves repeated or prolonged strain on the coccyx. For example, after sitting for a long time while driving or cycling, poor posture, being overweight or underweight. Root pelvi means pelvis. Pelvis is a bony structure in the lower part of the abdomen and hips, forming the foundation of the spine and supporting the upper body. Pelvis is composed of several bones, including the sacrum, coccyx, and the two hip bones, ossa coxae. These hip bones consist of ilium, ischium, and pubis, which fuse together as we grow. The pelvis serves multiple functions such as protecting internal organs like the bladder, reproductive organs, and parts of the digestive system. It also plays a crucial role in supporting body weight, providing a base for movement, and aiding in walking, standing, and other activities. Additionally, the pelvis is essential for childbirth as it accommodates and supports the growing fetus during pregnancy and facilitates the birthing process. An example for the root pelvi is pelviscopy, also known as pelvic laparoscopy or gynecologic laparoscopy, is a minimally invasive surgical procedure that involves using a specialized instrument called a laparoscope to examine and operate within the pelvic region. The laparoscope is a thin, flexible tube with a camera and light source attached to it, allowing the surgeon to visualize the pelvic organs on a monitor. During a pelviscopy, small incisions are made in the abdominal wall, and the laparoscope is inserted through one of these incisions. This provides a clear view of the pelvic organs, such as the uterus, ovaries, fallopian tubes, and surrounding tissue. The surgeon can diagnose and treat various gynecological conditions, including endometriosis, ovarian cysts, fibroids, and pelvic inflammatory disease. The advantages of pelviscopy include shorter recovery times, less scarring, reduced pain, and a quicker return to normal activities compared to traditional open surgery. It is often performed as an outpatient procedure under general anesthesia. However, the specific details and approach may vary based on the individual case and the surgeon's expertise. Always consult a healthcare professional for personalized information and advice. Another example is the pelvimetry. Pelvimetry is a medical procedure to measure a woman's pelvic dimensions, often done during pregnancy. It assesses the size and shape of the pelvis to determine if a safe vaginal delivery is possible. Measurements are taken at different points in the pelvis and provide vital information for planning the mode of delivery, especially when there are concerns about potential labor difficulties. Pelvimetry utilizes imaging techniques like X-rays, CT scans, or MRI, but it's not routine and is reserved for specific cases based on patient's medical history and circumstances. Another example pertaining to the root pelvis is pelvic inflammatory disease. This disease is caused by some STDs like chlamydia and gonorrhea. Is a reproductive organ infection caused by bacteria, often transmitted through sexual contact. It can lead to various symptoms such as pelvic and abdominal pain, unusual vaginal discharge, painful urination, and fever. If left untreated, PID can result in severe complications like chronic pelvic pain, infertility, ectopic pregnancy, and absences. Immediate treatment with antibiotics is essential to manage PID, and partners should also be tested and treated. Regular testing, safe sex practices, and timely medical attention can help prevent pelvic inflammatory disease.
Now, I will gonna explain to you the last root or base word pertaining to the skeleton, which is the ili or ilio, meaning ilium. And here are some of the medical terminologies using the root or base word ili or ilio. Number one is the iliopelvic. From the word itself, ilio means ilium and pelvic means pelvis. The meaning of the iliopelvic is it is pertaining to the ilium and the pelvis. Number two is the iliotibial band syndrome. Iliotibial band syndrome is a common overuse injury of the thigh and the knee caused by the inflammation of the iliotibial band, a thick band of the connective tissue that runs in the hip and the knee. And lastly is the iliopsoas. Iliopsoas refers to the muscle that flexes the hip joint that helps to stabilize the spine and the pelvis. And you know what, guys? Iliotibial band syndrome and iliopsoas typically occur in athletes, the one who's running, dancing, doing high jumps, and a lot more. And here are some of the treatments if you have iliotibial band syndrome or iliopsoas. Number one is you need to do the RICE method or the rest, ice, compression, and elevation. Number two is that take anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, pain reliever, if it is just persist by the doctor. Because kapag nag-take lang kayo ng gamot na walang reseta ng doctor is baka ma-worsen pa yung nafe-feel mo na iliotibial band syndrome or yung sakit. And if it is severe, kapag severe na yung sakit na yun is you need to undergo physical therapy para maging normal ulit yung function ng skeletal system mo. As you can see here in the picture, in the iliotibial band syndrome or the ITBS, it is mostly occur in our hips and in our knee because yun yung mostly na ginagamit ng ating mga athlete. Kaya kapag na-overuse sila and hindi sila nag warm up and nag training sila agad, magkakaroon sila ng iliotibial band syndrome. No? Kaya it is very much important na mag-warm up muna before going to training or sports, any kind of sports. And the second picture is the iliopsoas. So here is the image of the iliopsoas, guys. And that's it for the root or base words for skeleton. To simplify things up, let's summarize our presentation. Under the root or base words for bones and joints, here are the oste or osteo, meaning our bone. Miel or mielo, pertaining to our bone marrow, also our spinal cord. Next is the chondro or our cartilage. Number 4 is the arthro, meaning our joints. Synov or synovo is pertaining or meaning synovial fluid, synovial joint, or our synovial membrane. And last, for the root for bones and joints is the bursa or burso, meaning our bursa. Now, under the root or base words for the skeleton, here are crani or cranio, meaning the skull or the cranium. Spondyle or the spondylo, meaning our vertebra. For vertebra, meaning vertebra or the spinal column. Rachis or rachio, pertaining to our spine. Cost or costo, meaning our ribs. For our sarc or sacro, meaning our sacrum. And for the root or base word for coxi or coxio, meaning coccyx. Pelvi or pelvio, meaning our pelvics. And the last roots or base word for the skeleton is the ili or ilio, meaning our ilium. And that's the end of our presentation under the topic medical terminologies, specifically the root or base words for bones, joints, and skeleton. If you need any further information, feel free to contact me and my members. Thank you for your time, and we appreciate the opportunity to speak with you all today.